Let's now proceed to diagnosis according to the Ranfu organ patterns with heart blood deficiency and spleen Qi deficiency. Heart blood deficiency and spleen Qi deficiency is a pattern very common, especially in women. The pattern can arise from heart blood deficiency or spleen Qi deficiency. One pattern can lead to the other, and they will eventually become self-generating. Heart blood deficiency puts a strain on spleen Qi because the spleen has to work harder to constantly try and replenish blood. Spleen Qi deficiency is the post-heaven route of blood and can therefore lead to heart blood deficiency. The reason that this pattern is more common in women than men is that women lose blood through menstrual bleeding and childbirth and thus tend to be more blood deficient in general. Now let's go to its etiology. This pattern can occur when there has been blood loss, such as through heavy menstrual bleeding, childbirth, surgery, or physical trauma. The menorrhagia may in itself be due to spleen deficiency when the spleen is too weak to hold blood inside the vessels. The other causes of bleeding could be deficiency or excess heat or blood stagnation. The etiology of this pattern can therefore also include factors that lead to these conditions, and this pattern should be addressed in the treatment strategy either immediately or in subsequent treatments. Blood deficiency can also arise through excessive physical training, where the need for blood to nourish the muscles exceeds the body's ability to produce blood. Excessive mental activity can also weaken heart blood directly, as heart blood nourishes the shen and the brain. The spleen Qi deficiency aspect can arise because the spleen has to work extra hard to get more new Qi to replenish the lack of heart blood. Spleen Qi deficiency can also arise independently if the diet is of poor quality or if there is an excessive consumption of food and beverages that have a cold energy or temperature or that produce dampness. If the diet lacks food that is directly blood nourishing, this in itself can lead to or worsen the heart blood deficiency aspect of this pattern. Spleen Qi deficiency can also be a consequence of physical overexertion of disease. Worry, speculation, studying, and thinking too much can not only bind spleen Qi and thereby weaken it, but also affect the heart. Grief, sadness, and anxiety will also be factors that can have a direct negative impact on the heart. The symptoms and signs are palpitations, fatigue, dizziness, poor memory, pale and sallow face, pale dry lips, loose stools, poor appetite, being bloated immediately after eating, insomnia, dream-disturbed sleep, anxiety, being easily startled, scanty menstrual bleeding, the person may be absent-minded or not quite present, weak or low voice, pale tongue, choppy or fine pulse. The key symptoms here are insomnia, palpitations, fatigue, loose stools, and menstrual bleeding. The treatment principle with tonify spleen Qi, nourish heart blood, and calm the shen. For the acupuncture points, you can choose from heart 7, stomach 36, spleen 6, spleen 3, ren 12, ren 14, 15, bladder 17, and bladder 20. For the needle technique, we tonify, and moxa is also recommended on bladder 17 and stomach 36. For the further explanation on the choice of points, heart 7, ren 14, bladder 15, nourish the heart blood and calm the shen. Stomach 36, spleen 3, ren 12, and bladder 20, tonify spleen Qi. Spleen 6, tonify spleen Qi, nourishes blood and calms the shen. Bladder 17 nourishes blood. As a relevant advice, if there is spleen Qi deficiency, heart blood deficiency, and heart blood deficiency, a diet that is rich in food that both nourishes heart blood and tonifies spleen Qi is recommended. This means that the person should eat a lot of green leafy vegetables, beetroot, seaweed, dates, kidney beans, aduki beans, black beans, red meat, bone marrow, blood, sausages, nettle pea, heart, and liver. The food should be prepared, whether it's boiled, steamed, baked, and so on, and it should be eaten warm. They should avoid raw vegetables, cold drinks, ice cream, sugar, stimulants such as coffee, or too much alcohol. It is important that they chew their food slowly and thoroughly and that they eat in calm surroundings, focusing on what they are eating. Light exercise is beneficial as it will help support the spleen cheese mechanism. On the other hand, they should avoid sitting still for long periods of time or sitting with a slumped posture, especially after meals. Curfew also be avoided because it will weaken heart blood. Heart blood deficiency and spleen Qi deficiency can be caused by the following patterns of imbalance: spleen Qi deficiency, heart blood deficiency, liver blood deficiency, heart Qi stagnation, kidney yang deficiency, liver Qi stagnation, damp, and phlegm. In turn, this can result to spleen yang deficiency, kidney yang deficiency, kidney yin deficiency, lung Qi deficiency, and liver Qi stagnation. Can also result to liver blood deficiency, stomach Qi deficiency, damp, phlegm, heart yin deficiency, heart Qi deficiency, and heart blood stagnation. Thank you for your attention.